Hi, I'm Doug Major, an advocate for children's vision. I'd like to report to you on a issue that's happening in the state of California, the child care vision crisis. In so doing, we'll talk a little bit about what's happened to San Mateo County in particular and some interesting research from a Stanford professor. Memo January 1, 2020, Department of Healthcare Services required all the counties in the state of California to be unified under the PIA, which is the Prison Industrial System, to get glasses. This affected San Luis Obispo and San Mateo County, meaning 100% of all children now in the state of California under the Department of Healthcare Services have to use the prison authority, the exclusive sole provider, no bids, no competition, no choice. So what happened? Immediately after that happened, San Mateo's number of willing providers who signed up for PIA collapsed to just 4, even less. In Santa Barbara, San Luis Obispo County, SinCal Health actually flew to Sacramento to try to change the position. They didn't want to lose their provider panel. Since that time, there's been 3 new directors of the Department of Healthcare Services, so very little top leadership. They also watched, after 6 months of self-funding, their panels reduced to 100% in some areas, particularly the tribal areas. So had a little time, did an interesting surveys for San Mateo County, and here's the methodology. We used the public online eye care panel available to the Medi-Cal providers, and I called every doctor's site and asked these 3 questions. Do you currently serve Medi-Cal? Do you provide optical services for these patients? And what's had changed since the PIA has unified the fabrication? And here's the results if you want to take the time to look. In most cases, again, you notice how many people drop, no longer do glasses. Many of the main clinics in San Mateo Medical Center, the Palo Alto Medical Foundation, as well as the Stanford Hospital, didn't have an optical to begin with. So they were sending it to one particular optical called Eye Catchers. Eye Catchers could not afford to use that system, so they just asked people who come there to pay in cash. So in other words, we have a zombie panel now for eyewear, at least in San Mateo. I did a follow-up and found out that it's actually gotten worse. Again, still no coverage. And Palo Alto actually stopped taking any new Medi-Cal patients, meaning children. And so the latest job number just showed 607 jobs done for all of the school, or all the calendar year of 2020. And one office did the majority of those, and she's thinking about dropping. So that's what's happened. So what's happened, this lack of access to vision care and eyewear is now statewide. Comment by now retired superintendent of schools, founder of Vision to Learn, Austin Buhner. If deeply rooted poverty and an underperforming public school education system strike you as an intractable problem, think again. A simple yet powerful tool to kids in need, a pair of glasses. And we're talking about a lot of children now. This number has actually gone up to almost 5.5 million children in the state. 85% of children of color are under the Department of Healthcare Services. And since visual disorder is really the number one prevalent disability handicapping condition of childhood, why aren't we looking at this? And again, really just no priority, not on the budget. After the budget of the staff, there's only 2 assigned to vision out of the 4,000 members of the Department of Healthcare Services. And so an interesting story by Stanford humanitarian economist Scott Rozelle. Rozelle was one of the first exchange students to China after the opening, was involved in agriculture, but realized that the human capital was most important. Started doing work with this rural school children. And he talks about this, the evidence of overwhelming after giving glasses. Average scores soared by 86%. These simple interventions changed the whole child's life, Rozelle says. It's fantastic. So he gives thousands of free glasses to help the children, and actually goes all over China talking about the importance of this. And at the same time, as he moves to improve access to millions of glasses in China, in Stanford community, California's own Department of Healthcare Services has enacted policy that's collapsed access to glasses for millions in our state. So let's stop the loss of all this human capital. Vision care needs to be placed on the dashboard, have a priority. vision care truly is the forgotten essential benefit. Please join with us in adding this important and fixing this important inequality in the state of California for our wonderful children. Thank you.